Thank you. My name's Liz Kitching. I live in Leeds and I'm from Leeds Hands Off Our Homes, which is part of a national campaign to defeat the bedroom tax. I'm sort of assuming that by now everybody here will know what the bedroom tax is, but if you don't know what it is an attack on people who are in receipt of housing benefit and happen to have a bit of spare floor and walls. That is what it comes down to. Now, we're being ruled by a government, I think, of sociopaths and psychopaths, and so much so they'd like our bedrooms. The fact that there's nowhere to go and that you've nothing to pay with doesn't matter to them. And so thousands and thousands of us up and down the country have been campaigning, fighting, researching to show exactly that this tax is unfair, unjust, pernicious, but above all unworkable. And what it really is an attack on social housing, an attack on council housing. The Tories don't like the idea of anything social, you know, that's good for everyone, that means that everybody's got a home that they can feel secure in for as long as they need it. They hate the idea, don't they? And so thousands of us, probably tens of thousands of us, from Scotland down to Brighton, up to Belfast and all across the country, are fighting like mad. But what we're having to do more than anything is actually support individual tenants and families about their rights, because you'd be absolutely surprised when you find out that the councils, I can only really speak for Leeds Council, telling us in Hands Off Our Homes that they are doing everything they can to support tenants, when in fact they're doing precisely the opposite. And by that, what I mean is they are pursuing people out of their homes. They are receiving texts, emails, visits from housing officers, demanding to know, what are you going to do about moving? And if you can't move, what are you going to do about paying? So if an individual tenant tries to find somewhere to move to, and it might be ideal, oh well, you can't move because you've got rent arrears. So the fact of the matter is it's absolutely impossible for tenants. And I can tell you the hardship is so, I mean, I'm a bedroom tax victim myself, and I'm having to look every day to try and find somewhere to live, and there isn't anywhere to move to. It's even worse if you have a disability or a mental health problem. It's worse if you're a separated family and you'd like to have your children at the weekend and things like that. It's absolutely appalling. But it's also causing chaos for housing allocations. So people who are already on the waiting list have got absolutely no chance of getting anywhere to live. So we've asked the council to say that we won't evict and that we will pledge to build social housing, but we're not getting any of that from Leeds City Council. What instead we're getting is, well, we've reclassified 800 properties. Well, these 800 properties never should have had a dining room called a bedroom anyway, so they've been sneaking the money, excuse me, you know, for rent that really shouldn't have been collected in rent. And on top of that now, we've got the poorest people being screwed for the council tax. And I'm telling you, every Thursday morning, my comrades and I, we go down to the magistrates' courts in Leeds to see the poorest people of Leeds dragging themselves along, not knowing what's going to happen, thinking that they're going in front of a magistrate to try and negotiate and explain.
Comrades. My name's Debbie Wilkinson and I'm the chair of the Unite the Union National Ambulance Committee. I'm also the branch secretary for Unite in the ambulance service here in Yorkshire. My most important role, though, as I see it, is that I'm proud to have been an operational NHS paramedic here in Leeds for 22 years. I'm really pleased, as Liz said, to speak to you this evening and be part of the People's Assembly as we fight back against these austerity cuts. I'm here because the NHS nationally and in all UK ambulance services we're currently undergoing, I'm talking massive and savage cuts to frontline services. Services that deliver to all of you the best level of free healthcare envied around the world. Now I know it sounds like a cliche, but things have honestly never been as bad as they are now, as we face the seemingly systematic dismantling of our NHS. Now, as we all know, the buzzword of the Tory government is austerity. However, their idea of austerity leads to huge and unnecessary cuts to frontline emergency services. For us, this has meant massive downgrading of operational ambulance staff, and new staff are now working on frontline ambulances with only 6 weeks training. Only 3 weeks of this is clinical and 3 weeks is driving. It equates to little more than an advanced first aid course. This is due to the introduction of a new role called the Emergency Care Assistant, or ECA role, a role which has been tried and shown to fail in many other parts of the country. But the ambulance service don't tell you that. These new ECA roles have been brought in to work with paramedics who, for comparison, have to complete a 2-year degree course. Also, the qualified technician role that the ECA replaces currently does a 9-week training course, not 3. Yet, under the guise of the cuts, the skilled technician role is to disappear altogether. So why are we reinventing the wheel in Yorkshire? Because it's cheap. And all ambulance services have been told by the government to make cuts, massive cuts, and they affect your response when you ring 999. Around the UK, these cuts have achieved, equate to 6% improvement cuts over the next 5 years. So in Yorkshire, that equates to £46 million over 5 years, or 10.3 million this year alone. So when faced with the membership ballot as to whether to accept these catastrophic cuts, Unite members in the ambulance service said no. We said no convincingly with a 98% rejection of the Trust's proposed workforce plan and voted to take part in industrial action to protect patient services. We delivered this rejection on the 31st of January this year to the ambulance service. As a Unite branch with 500 members, we said austerity doesn't work and cuts don't work, and neither should it affect vital frontline services. So what was the Trust's response? On the 4th of February, just 4 days later, the Trust formally de-recognised Unite as a trade union for collective bargaining, with no explanation, only that Unite's response was disappointing and not constructive. If my members say no because they feel the proposals are unsafe for patient care, then I'll say no on their behalf, constructive or not. This essentially said that as a trust they weren't prepared to listen to 500 of their own staff who were saying that cuts were dangerous to the future of patient care. They don't like what we have to say, so they decided they no longer wanted to listen. Ironically, the de-recognition came 2 days before the Francis report was published in mid-Staffordshire, which encouraged NHS staff to speak out and voice concerns over patient safety. We then delivered a positive ballot for industrial action against the workforce plan and the de-recognition. We didn't do this lightly because no emergency worker ever wants to go on strike. But since we were de-recognised, the pace of change in Yorkshire has been staggering. Since February, the new ECA role has been introduced in large numbers of up to 100. These staff have been expected to learn on the job from their peers instead of being properly trained or indeed properly paid for what they do. This is not fair on those staff, the other staff like me who work with them, or the public. And increasingly throughout the country, private ambulance crews are also being used to plug the gaps in frontline services. These crews answer your 999 calls. They wear the same uniforms, drive identical vehicles, although not always with the same equipment, but work with very little governance. Many of these firms employ staff that have left NHS ambulance services for various reasons, including ill health or have even been sacked.
Thank you, Matthew. Thank you very much to the organisers for asking me to come and speak on behalf of Keep Our NHS Public. And it's fantastic to see so many people here, and it's inspiring to hear other speakers like Liz and Debbie. I work as a doctor at the infirmary, very close to here, and I've worked in the health service now for 36 years. And I'm determined it should remain a comprehensive and public service that's funded out of general taxation and free to people when they need health care. And I work with other people in Keep Our NHS Public with this aim in view, and we have monthly meetings now at the George pub opposite the infirmary. We network with other groups, and I see there's colleagues from York at the back there, from Harrogate, probably other places as well. We've done quite a lot of networking with similar groups who are fighting to defend the NHS. We also hold regular stalls in town for leafleting, particularly drawing attention to the privatisation of healthcare by such companies as Virgin. And with the introduction of the Health and Social Care Act last year, we now have to talk not about an undermining of the NHS, a process that's pursued by successive governments over many years, but we have to talk about the abolition of the NHS. Similarly, we shouldn't be talking about creeping privatisation any longer, but galloping privatisation, because that's the reality. And let me just give you a few examples. Since the 1st of April this year, when the Health and Social Care Act came onto the statute book, there have been £1.5 billion worth of contracts for over 100 NHS clinical services that have been advertised. And nearly all of those have been won by the private sector. Clinical commissioning groups, which, as you know, replaced the PCTs, the Primary Care Trust, now decide on how money will be spent on services. And they've started to implement new restrictions on referrals through to secondary care. They're tightening the thresholds for access to surgery, or they're creating new referral gateways to restrict the number of patients being sent to hospital. And this is well documented, and it's increasing. 1 in 7 clinical commissioning groups have tightened criteria for referring patients for so-called low-value treatments. The Royal College of Surgeons has pointed out that many of these have actually been proved to be effective in preventing complications later in life for patients and making their lives miserable. But these are the kinds of things which will be restricted. 1 in 6 hospitals in England have expanded private patient options this year, and now trusts can earn up to 49% of their income from private patients. They're clearly being encouraged to expand private practice.